In this video, we will be talking to you about the oral anti-cancer drug, capecitabine.
Capecitabine is FDA approved for treatment of different types of colon cancers and breast cancers. However, it can also be used for other types of cancers beyond these two types. What makes cancer cells different from regular cells is that they grow very quickly. Capecitabine targets cells that grow quickly and it destroys the DNA of the cell, killing it. Capecitabine is usually dosed every 12 hours on the days you are supposed to take it. How often during the cycle and how many cycles you take it for depends on the treatment plan developed for you by your provider, what type of cancer you have, and how far along your disease is. You want to take your medication at the same time each day. Take it within 30 minutes of eating a meal. Do not crush or chew this medication. You want to swallow it whole with a full glass of water. If you miss a dose of your medication, skip the missed dose and take your next dose at its normal time. Do not take 2 doses at the same time or extra doses to make up for a missed dose. If you take your medication and throw up, do not repeat the dose. You want to store this medication at room temperature in a dry place, tightly closed and out of reach of children and pets. If you have a caregiver that handles your medication, it is best if they wear gloves and avoid touching the medication directly. They should wash their hands before and after handling the medication. Pregnant women should especially be careful and should avoid touching this drug.
Patients who may become pregnant should be using a form of birth control for the duration of treatment and for 6 months after their last dose of capecitabine. Patients who have partners that may become pregnant should use a form of birth control for their duration of treatment and for 3 months after their last dose of capecitabine. This is because capecitabine has the potential to cause harm to a developing baby. This medication can interact with other medications due to the way it is broken down in the body. One interaction it has is with warfarin, a type of blood thinner, where it can lead to increased risk of bleeding or changes to blood clotting labs, like the INR. It can also interact with proton pump inhibitors used to treat heartburn and acid reflux. This class of drugs makes capecitabine less effective by stopping your body from absorbing it. Other medications for heartburn, like Pepcid or Tums, should be spaced out by 2 hours from the time you take capecitabine. Another interaction is with phenytoin, an anti-seizure drug, where its concentration increases when taken with capecitabine.
Capecitabine, like many medications, has a variety of side effects. One side effect is hand-foot syndrome. This side effect is characterized by redness and swelling of your hands and feet, as well as tingling of the palms of the hands and the soles of the feet. These symptoms may start to appear within days or weeks of starting capecitabine. Experience these symptoms, your prescriber may hold or stop capecitabine. They may also suggest preventative measures such as avoiding irritation to your hands and feet. This can include avoiding long walks, making sure not to carry heavy or rough materials without gloves, and avoiding skin irritants such as disinfectants, perfumes, machine oil, or laundry detergent. They may also prescribe 10% urea cream, celecoxib, clobetasol, silver sulfadiazine, or polyhexanide, all of which are used to treat and soothe symptoms of HFS. Some other skin-related side effects include darkening skin, which usually goes away on its own following discontinuation of treatment after a period of time, and getting sunburn more easily, which can be avoided by staying away from direct sunlight, wearing protective clothing, applying at least SPF 15 sunscreen every time you are going to be exposed to the sun, and other sun protective measures. Another common side effect is mucositis, which is where the tissue in your mouth gets inflamed. Symptoms for this include painful sores in your inner cheeks and difficulty eating, drinking, or swallowing. Left untreated, this can lead to severe dehydration and possibly a viral or fungal infection. The best way to deal with this inflammation is to brush your teeth twice a day and to use mouthwash. Different mouthwash options can include alcohol-free mouthwash, magic mouthwash, and baking soda and salt water mouth rinse, which you can make at home. You can also take pain relievers like Tylenol for the pain. For potential severe dehydration, you may require hospitalization to receive IV hydration and stronger pain medications. For infection, you may be prescribed either an antiviral or an antifungal depending on what kind of infection you get.
You can also experience diarrhea on capecitabine. This could lead to dehydration if it does not resolve on its own. Usually diarrhea is managed with maintaining proper fluid hydration using water or Pedialyte and avoiding sugary drinks. It's also managed by eating foods like bananas, rice, applesauce, and toast. If you require treatment using medications, you may be directed to take over-the-counter loperamide. The frequency and duration recommended will differ from what is normally recommended on the package. Other common side effects of this medication include hair loss, stomach pain or upset, headache, trouble sleeping, changes in nails, dry skin, eye irritation, tiredness and weakness, nausea and vomiting, changes in taste, decreased appetite and weight loss, and muscle or bone pain.
During treatment, your doctor may order lab work to monitor for safety of the medication. This may include a complete blood panel to look at your blood cell counts and tests to monitor your liver and kidney function to see how your body is handling breaking down this medication and getting rid of it. We hope this video provides you with some valuable information. If you have any further questions, please contact your pharmacist or provider directly.